So, our next topic related to exercise testing is going to be all about testing cardiorespiratory or aerobic fitness. So, when we test for aerobic fitness, our criterion measure, which is what we're trying to measure or estimate, and this is the best measure of aerobic fitness we have, is called maximal oxygen consumption or VO2 max. So, hopefully, you remember a little bit about VO2 max from exercise physiology, but defined again, VO2 max is just the body's maximal ability to intake oxygen, transport it, and also utilize it. So it's going to depend on two major things: cardiac output, which is the amount of blood coming out of the heart, and also arteriovenous oxygen difference, or AVO2 difference, which is a measure of oxygen extraction from the blood. So the classic Fick equation is VO2 equals cardiac output times AVO2 difference. And we can just rewrite that for VO2 max and just relate it to maximal cardiac output and maximal AVO2 difference. So we commonly report VO2 max in units of relative units of milliliters per kilogram per minute, which takes into account body weight, and that allows us to compare people. VO2 maxes of people with different body weights, and also allows us to compare a VO2 max to established norms. You can also report VO2 in absolute units, which do not take body weight into account, but that is done a little less frequently, and the units there would be liters per minute. So VO2 max is important for health because there's a lot of data out there that associates low aerobic fitness levels with increased mortality and cardiovascular disease. And even the American Heart Association has labeled aerobic fitness as a very strong predictor of mortality, even more so than other established risk factors like blood pressure and cholesterol. So to get a measure of VO2 max, you can directly get it via a maximal graded exercise test. And a graded exercise test just means that it's an exercise assessment where the intensity gradually gets higher and higher. And that's why we call it graded, because each stage is considered a grade. But a maximal graded exercise test, the person would work until they can no longer keep going, until they reach their max. And during that test, you would actually measure oxygen consumption while they're doing this effort. This is sometimes referred to as a symptom limited graded exercise as well, just denoting that you would stop the test if they had any symptoms. You can also do submaximal graded exercise tests where there's a predetermined termination point. Commonly, that's about 85% of your max heart rate. But from that data that you get during that submaximal effort, you have to extrapolate, generally using heart rate, and you estimate VO2 max based on that. And then there's field tests where you can estimate VO2 max just based on performance during some activity or the heart rate response to exercise. In field tests, obviously, you doing that, you would lose a little bit of accuracy. Same with the submaximal graded exercise test because you are estimating VO2 max instead of actually measuring it. Some pros and cons of maximal versus submaximal. As you can imagine, for maximal tests, they're the most accurate. They're also the most sensitive as far as detecting disease that might be present. The negative things about them, they're potentially dangerous because the person does have to work to their max. They can be expensive because it requires expensive equipment like a treadmill or a bike, and then also a metabolic cart to measure oxygen consumption, and thus it's more time consuming. Submaximal tests are basically the opposite. So lower risk, cheaper, less time consuming, but the cons are they're generally less accurate and less sensitive. Modalities for graded testing generally include a treadmill or a bike. So with the treadmill, you can do graded maximal test, graded submaximal test, cycle ergometer, you can do a graded max, graded submax. But other modalities that are out there include step testing, and those commonly rely on the post-exercise heart rate response to estimate VO2 max. And then there's field tests, which you generally walk or run a certain distance or run or walk for a certain period of time. And from that data that you get based on performance and sometimes a heart rate response, you can use regression equations to predict or estimate VO2 max based on that response. So some of the common protocols that are used for the treadmill, there's a lot of established graded protocols. These include the Bruce, modified Bruce, bulky Nodden. For the bike, there is one established graded exercise test, but it's a submaximal test called the YMCA submax test. Or for most bike protocols, you just design your own protocol, and that generally involves starting at a certain intensity and having small increases in intensity every few minutes. There's also an Ocean rhyming test, which it's a steady state test where you just exercise at a certain intensity for 6 minutes and then predict VO2 max based on the heart rate response. For field tests, common ones that are done: 1 mile walk, 1.5 mile run, 12-minute run, 6-minute walk. And then for step tests, probably the most common one that's done is called the Queen's College Step Test, which lasts for 3 minutes. And you just measure the post-exercise heart rate and use a regression equation to estimate VO2 max. So when choosing one of these modalities or protocols, you have to consider the participant. If they're in really good shape, you could always start with a more aggressive test. You could start at a higher workload. Someone who's in not so great shape, you could start it on the lower end, or maybe do a walking protocol as opposed to a running protocol, or just have smaller increases in intensity throughout it. So generally, you want to make sure that the test that you're using is appropriate for the individual that you are testing. So here is the Bruce protocol, what it looks like. This is what I would call a quick and dirty protocol. As you can see, it starts out pretty slow related to speed, but the incline is actually pretty steep. So this protocol gets people to their max really quickly. But the trade-off is that it might be overly aggressive for someone who's not either used to walking up a hill or running up a hill, or someone who's not in great shape. Next, this is the modified Bruce. You can see it's really similar, but it just has a couple of extra stages at the beginning. Here's the bulky protocol, which is strictly a walking protocol, and you can see that speed stays the same, but the percent grade just goes up every minute. And then there's others. Naughton's a walking protocol. A ramp protocol, by definition, has small frequent increases in intensity. So this could be something as simple as a 1% increase every 30 seconds, or even quicker every 15 seconds. But ramp protocols in generally provide a smoother transition between the stages, and instead of having a large jump every few minutes, it just has smaller increases in intensity every few seconds. As far as cycle ergometer protocols, there aren't really any major graded protocols that are out there other than the YMCA submax. But if you want to do a maximal test, you generally have to design your own bike protocol. And so when doing this, you generally want to base it on the person's fitness level. If they're in pretty good shape, you could start out at a higher intensity and have bigger increases in intensity every stage. Not so great shape, you start lower and have smaller increases in intensity. And this is the YMCA bike test that I was discussing. We are going to do this one in class, but you can see it's a submaximal test, so there are 4 stages. So everyone starts at 0.5 kilograms of resistance. And then based on the heart rate after that first stage, you follow one of these columns all the way down. So if your heart rate's 85, you'd go into this column. The next stage would be 2, and then 2.5, and 3. Over here, if you were greater than 100, the next stage would be 1, 1.5, and 2. But regardless, after the 4 stages, you stop. You have all your data, and then you will estimate VO2 max based on the heart rate response to this protocol. So some of the measurements that you would take during a graded exercise test include what I call the big 3: heart rate, blood pressure, and rating of perceived exertion. And then The other measurements that you see listed here are not necessarily necessary in all cases, but they might be. So if you're doing, like, for instance, a direct measure of VO2 max with a maximal test, you also need to measure oxygen consumption. If the patient or client has any cardiovascular issues, you might want to record an EKG as well. Then there's other subjective scales as well. So if somebody has chest pain, you can use the angina scale to see how they're feeling. If they have a pulmonary issue, you can use a dyspnea scale if needed. Leg pain, you can use the claudication scale. Even oxygen saturation you can use if someone has severe pulmonary issues. The other thing that's not listed up here that I think is really important is just monitoring the person's signs and symptoms during the test. So if you want to, instead of calling it the big three, call it the big four. The four things you always measure during an exercise test are heart rate, blood pressure, RPE, and then also monitoring the signs and symptoms. So here is the RPE scale, if you're not familiar with it. The classic RPE scale is a scale of numbers from 6 to 20. 6 would mean no exertion at all, 20 is maximal, and the person just gives a rating every stage generally during an exercise test, or sometimes more frequently, and it gives the tester an idea how they're feeling. You can also use a 0 to 10 scale, but for laboratory purposes, most times the 6 to 20 scale is preferred because it correlates well with VO2 and also heart rate. If you did need to use the angina or dyspnea scales, this is what they look like. But again, you would only use these if the person has some pre-existing condition where you know they're going to have chest pain or that you know they're going to have breathlessness during the test. And as far as when to terminate an exercise test, generally when the person wants to stop, that's when you stop. But there are other indications for stopping an exercise test. So this list is in what we would call an apparently healthy adult. So anything, if the person exhibits any of these things, you should stop the test immediately. So these are good to know. So onset of angina, again, this is in what we would consider a healthy person. So if a healthy person starts having chest pain, you'd want to stop. Drop in systolic blood pressure, that's not a good thing. So that would also be a reason to stop. On the other hand, an excessive rise, and I circled these numbers because I think these are numbers you should know. Systolic greater than 250, diastolic greater than 115, that's criteria to stop. And then any of these other things, shortness of breath, poor perfusion, failure of heart rate to go up, noticeable change in heart rhythm. Number one thing, as I said, the subject requests to stop. If they start looking really bad, so physical or verbal manifestations of fatigue. And then also you have to consider failure of the testing equipment. So if, for instance, the heart rate monitor isn't working or blood pressure cuff isn't working, you can't effectively run the test to ensure the patient's safety, so you would need to stop. All right, so general procedures when doing a GXT or graded exercise test. Before the test, obviously select the protocol you're going to use. Record blood pressure, heart rate, EKG if necessary, in the exercise positions. If they're on a treadmill, just standing, on a bike, sitting on the bike. Familiarize the subject with the modality. Tell them how they're going to ride the bike or be on the treadmill, etc. Explain the RPE scale so they know what kind of numbers to give you and what it's supposed to reflect. Any other pre-test instructions, like how are you going to be taking blood pressure, are you going to be asking them for RPE, etc. If you're collecting oxygen consumption, you want to get some nice resting data as well. And then that's generally followed by a 2 to 3 minute warm-up. And during the test, this is probably the most important. You want to get a heart rate every minute, blood pressure at least one time per stage, generally towards the last part of the stage, so I always say during the last minute. RPE, you want to get every stage, but personally I like to get it every minute because it gives you a better idea of how the person's feeling. Constantly monitoring the signs, symptoms, as we discussed. Other possible variables like EKG, expired gases, etc. Then these are only if you're going to measure those. Something to consider if it's a submaximal graded exercise test. You should have at least 3 minute stages to ensure that their heart rate reaches a steady state. And to do that, you want at least 2 heart rates. Generally, if it's a 3 minute stage, the end of 2 minutes and the end of 3 minutes, get a heart rate, and then you have to make sure they're consistent. So if they're not within 5 beats per minute of each other, you'd want to extend the stage to ensure that they reach a steady state heart rate. Then after the test, most commonly you want to do an active cool down, just a low workload. Usually the workload is at the first, same workload as the first stage. If they have any major symptoms like they get nauseous, lightheaded, you could have them lie down, put their feet up. That generally helps. But assuming they can continue to exercise, you want to continue to monitor the heart rate, blood pressure for at least 5 minutes, maybe longer if anything abnormal occurs. Heart rate during recovery, recorded each minute, blood pressure, immediate post-exercise, and then about every 2 minutes during recovery. RPE, you don't need it in recovery, just get it at peak exercise. Continue to monitor the signs and symptoms, and if you are measuring an EKG, you'd want to collect that as well during the post-exercise period. All right, so talking about a submaximal test, like we said earlier, submaximal graded exercise tests have a predetermined termination point. Usually that's going to be about 85% of predicted max heart rate. And so the whole idea behind this is that since heart rate increases linearly with intensity, we can estimate heart rate max even using 220 minus age. As simple as that is, we can extrapolate the heart rate response to estimate the maximal workload. So what that might look like is this, where in this data, this is out of the textbook, you have 2 points that were actually collected during the graded exercise test. I'm assuming they were exercising here as well, but these are the last two, maybe stages 3 and 4. So they get a heart rate of 130 there, in stage 3 and stage 4, heart rate of maybe 145. So you can connect those, and we're going to assume there's a linear response there. And if the person was able to keep exercising, their heart rate would keep increasing linearly. And if we extrapolate that line up to their age predicted max heart rate, we can come down and basically estimate what workload they would have got to if they did continue all the way to their max. And from that max workload, we can then go back and estimate VO2 from that. And we'll have that discussion later, how to estimate VO2 from a given workload. So back to estimating max heart rate, simple way to do it, 220 minus age, which is easy. Problem is it tends to over and underestimate in certain groups, as you can see. So there are more accurate maximal heart rate equations. So you can see them here. Based on the population, you could pick one of these ideally. So generally what I suggest is that if you need an estimate of max heart rate really quickly, 220 minus age is fine. But if you're actually doing a test and you want it to be as accurate as possible, use one of these equations here based on the person who's doing the test. So you can see there's a slight description of each equation and who it's most appropriate for. So this slide kind of represents what it might look like if you were doing a submaximal test and trying to extrapolate it to estimate VO2 max. So let's say the person did 4 stages on the YMCA bike test, and we terminated it because they got to 85% of their max. That's their nice heart rate response. And we could estimate their max heart rate. Again, I'm using 220 minus age here, but ideally you would use one of the other equations that are a little more accurate. And then we just take that response and we extrapolate it through that max heart rate line. Then we can draw a straight line down and we get an estimate of their max workload. So that's the workload we think they would have gotten to if they were allowed to continue to work to their max. And so just based on this graph, I would say maybe you're 1125, something like that. And then once you get that max workload or estimated max workload, you can actually estimate VO2 max from that, or estimate VO2 with that, because there are equations that you can put workload into, and it will give you the estimated VO2 at that workload. So these in your book, I'll have a separate lecture about this, and I call them metabolic equations. So there's established equations for walking, running, cycling, stepping as well. And then if you're interested in normative values of VO2 max, what's considered good versus bad, they're all found in your textbook. So again, YMCA bike test, this is the protocol, but like I said, it's 4 stages. Everybody starts here, and then based on the heart rate response, you follow one of these columns all the way down, and after the 4th stage, you stop, and then you just kind of use the graph and extrapolate the heart rate like we described in the previous example. So this is actually data that from an actual test that I put together. So you can see they did 4 stages, and I extrapolated a line. If these dots don't all line up, if the heart rate seems a little less than linear, generally you want to use the last two to make sure at least those are consistent. And then you draw the line up, cross the 220 minus age or estimated max heart rate line, come straight down, and it'll give you the estimated max workload. So when we do a submaximal graded exercise test like this, again, it's not going to be as accurate, and we are making several assumptions that some are really good assumptions and some cannot be so good at sometimes. So these assumptions include that a steady state heart rate is obtained at each workload. We can justify this because if we have 2 heart rates within each stage and they're within 5 beats per minute of each other, we can ensure that a steady state heart rate has been reached. Also, we're assuming that there's a linear relationship between heart rate and workload, which there is, so that's a good assumption. We're assuming that the max workload is indicative of VO2 max. That could be a great assumption, could be not so great depending on the person. We're assuming their age predicted max heart rate is correct. We know there's a little bit of error associated with that, so it's a good assumption, but there's some error with it. We're also assuming that the oxygen consumption at a given workload is the same for everyone. So basically, we're assuming those metabolic equations that I talked about are accurate. And then lastly, we're assuming that the person is not taking any medications that could influence their heart rate response. All right, so as far as other cycle protocols, another one that we will look at in class, it's called the Ostrand rhyming cycle test. And in this test, it's just 1 stage. It's a 6-minute test, same workload. The workload's dependent on sex and then also fitness level. And then the person just works at that workload for 6 minutes. You need 2 heart rates, generally at the last 2 minutes, minute 5 and 6. As long as the heart rates are between 125 and 170, they're valid. And then you just use this nomogram to estimate VO2 max. And you're also going to have to use the correction factor, but we'll talk about that in class. So, for instance, if their heart rate in this case for women, if their heart rate during that test was 152 and their workload was 600, maybe you see that right here, you just draw this line across, and then this would be their estimated VO2 max. And this is in absolute units. Notice that it's in liters per minute. So we could easily convert that to relative units by using their body weight. All right, other tests, there's the Queen College step test. It's pretty straightforward. There's 3 minutes. You use a step with a certain height. There is an established stepping rate for males and females. And we don't really measure anything during this test. The person just steps up and down for 3 minutes. And then during recovery, we take a 15-second heart rate and then put it into these equations to estimate VO2 max. All right, as far as field tests go, some of the more common ones that are out there, there's a 1.5 mile run. It's just the time that you get. You put that into this equation. It gives you an estimate of VO2 max. There's a 12-minute run, and it's basically how far you can go in 12 minutes. Put that in, and you get an estimate of VO2 max. There's a 1 mile walking test that you can use, which looks like a little bit more complicated equation. But regardless, you take into account the person's body weight, their age, their sex, and then how long it took them to walk the mile, and then also their heart rate after that mile. All that goes into the equation to estimate their VO2 max. All right, getting back to the risk of exercise testing, you've seen this before, but I'll just point it out there again. The risk of exercise testing, even maximal testing, is actually really low. So, risk of cardiovascular events during exercise testing is that same number that you've seen before, 0.06%. So, this is always something that you would want to explain to the participant going in, that the risk of these tests is actually really, really low.